Hello and thank you for joining us on Black Issues Forum. I'm Deborah Holt Noel. As we close out the month of January, North Carolina's COVID-19 metrics continue to climb. Health officials are also dealing with the challenge of vaccination. But NC Central University is among the schools stepping in to help with that process. David Hurst reports.
When Pfizer announced their COVID-19 vaccine had to be stored at ultra-cold temperatures, some health departments across the state didn't know how they'd store it.
And we heard from several of them that we don't have the storage capacity that the Pfizer vaccine requires.
UNC System University stepped up and found funding to get more than 60 ultra-cold freezers to distribute across the state. The state's 6 historically minority-serving institutions will receive additional mobile freezer units to serve rural areas and underserved populations. That includes NC Central, who will receive 7 freezers and distribute them to sites in Durham, Halifax, Granville, and Vance counties, where ultra-cold storage is not available.
We have obtained 1 freezer, and we are getting a couple more in this week, and we'll be providing them to public health departments, including the Lumbee tribe.
Dr. Deepak Kumar, director of the Chambers Research Institute at NC Central, says these freezers will help overcome a logistical challenge that many communities are facing, and it will help them safely store the COVID-19 vaccine.
If you're not able to vaccinate people, then it's going to be a big problem. We have high-risk individuals, and we know how COVID-19 is affecting disproportionately to underserved minorities.
The freezers are also expected to support hospitals and pharmacies. In Durham, I'm David Hurst reporting.
And of course, storage is only a piece of the puzzle that is vaccinating millions of people. And right now we're joined by someone who knows the challenges all too well, North Carolina's Secretary of DHHS, Dr. Mandy Cohen. So happy to have you with us, and thank you once again for taking the time.
Great to be with you, Deborah.
One of the recent strategies has been to develop mass vaccination sites to try to get more vaccinations into the arms of North Carolinians faster. But some health providers have been frustrated because they say that this is cut into their supply. What's been the impact of the mass vaccination program?
Well, I think that our vaccine providers have done a tremendous job. As you know, we got off to a little bit of a slow start, but as we're sitting here today, this past week, we had allocated and delivered every single first dose vaccine that came to North Carolina. That's incredible. So there were no vaccines sitting on the shelf, and that's a testament to the really hard work of all the vaccine providers. And it is going to take a range of strategies. There's no one single strategy for getting this many vaccines out so quickly that's going to get us to our goal. So we want to have some of those more high throughput places where folks can come, but we know we also have to get out into every single community across North Carolina. And that's the balance that we're trying to seek. So we have to get speed and we have to get equity.
Absolutely. And how are we doing on supply and demand?
I will say we do not have enough vaccines here in North Carolina. Nowhere in the country does, right? We are very, very, very limited on supply, and that is the takeaway message. Now, we did have some, that was a backlog a few weeks ago. That is no longer the case. Now we are using every single dose the minute we get it here into North Carolina. And the reality is there just aren't enough doses to go around for everyone who wants it. As you know, Deborah, we're vaccinating those who are over 65 and over, and all our healthcare workers, but we know the demand is so much greater than the supply of vaccine right now. So everyone's going to just have to be patient. We'll get to you. I promise. Everyone's going to have a spot to get their shot, but it's going to take some weeks and months for us to get there.
And I'm sure that African-American communities and other communities of color are anxiously awaiting numbers to increase for the number of folks who are getting those vaccinations. And I know that the DHHS has worked very hard with knowledge that the disparities have been well documented. But once again, yet African-Americans and communities of color are not getting those vaccinations as quickly as perhaps other communities. What are you all doing to adjust and address that issue?
It's very significant concern to me. And the way we are moving forward in giving out vaccines is very much trying to bake in equity. So first, we are giving counties more vaccine if they have a higher proportion of those who are African American, Hispanic, Latinx, Native American. So we want to give you more vaccines. That's the start. Then we also want to support vaccine events that we know are reaching out specifically to our historically marginalized populations. We want to see partnerships with the faith community, with community-based organizations that know how to reach the community, because we know this is about trust, right? Trust and access. And so we need to see that from our partners, and we at the state want to support partners who are working in a trusted way with their community. So they get more vaccine if they have more of the historically marginalized population they're serving, more vaccine if they are using events to target those communities and really get into those communities. And then there's a lot of just best practices that we are sharing with folks about setting aside appointments, using off hours, going on the weekend, using church locations. There's a lot of different ways. We also just put out about $2.5 million in transportation benefits, because we know we have to not just put the sites in the right place, but then folks still are going to need transportation to and from. So we're trying a lot of different strategies here to get folks access to vaccine.
Well, we know President Biden has set a goal of vaccinating or getting vaccinations into the arms of 1.5 million people a day. What do you think about that goal, and how is North Carolina tracking for you in your goals for COVID-19?
Well, our vaccine providers, as I said before, have been doing a tremendous job. So now we are getting out all of those first doses that come to us. We're getting them right out. So as of the beginning of our vaccine week, if you were, we had 99% of our first doses were out in arms. That is terrific. So we're able to keep pace. The real issue now is how much vaccine do we get to our state? And we want to be at the front of the line. North Carolina wants to be at the front of the line, telling the federal government we can handle more vaccines. We have the capacity. We're ready and raring to go. And we've heard that from the Biden administration. They actually gave us a bump up this week in our allocation. Not a lot, 15% more, which really translates into about 20,000 more vaccines. I'll take it, though. We'll take it here in North Carolina, and the more we can get for our state, the better.
Well, every bit counts. And Dr. Cohen, thank you for the work that you're doing, and thank you for being with us.
Well, thanks, everyone. And remember, we're still in the middle of this pandemic, lots of virus around. So do your 3 Ws, wear a mask all the time, wait physically distant, and wash your hands. Thank you, and stay well.